Good day, this is William Groote. Let us discuss some few issues relating to housing in retirement, and allow me to present to you Ms. Val Heiway to actually highlight the importance of this issue. Thank you.
Thank you very much. Good afternoon, everybody. And no, I'm not going to answer those tax questions. That's not what I'm here for. I work for the Cape Peninsula Organisation for the Aged. I'm actually the nursing services manager, but I'm also been asked to on several occasions, and some of you who've been to these sessions before might have heard the story before, so I apologize for that, because the information doesn't really change. What I started off with in terms of talking about planning accommodation for retirement, first of all, and I'm also facing this situation myself, it's looking at what do you mean by retirement and what do you mean by aging. And we all have mindsets about what it is, and you have a mental picture of what it is to be old, and that's not me. That's somebody over there who's different to me. Frailer, more immobile, less able, memory gone. That's what people think about old. But it doesn't apply to you, and it doesn't apply to me. So we've got to re-look at what we mean as we're getting older, and decide what it is that is acceptable. We are, majority of us here, the baby boomers, the generation born between 1946 and 1964. And we're different to the pre-1946 people as they got older. And if you look at your parents and your grandparents, you will see the difference of the people of today reaching retirement. And we bring a different feel about retirement. Retirement for me is a bit like getting to the end of matric at school as your next career. This is a life change. It's different to what you've done in the last 20, 30, 40, 50 years. But it's an opportunity to do something different. And it brings with it the need to stay healthy and be involved and active. The baby boomers have a tendency to be very critical as well. Believe me, I deal with them every day in the aging facilities. Which of these numbers do I hit? That one. Okay, when I'm 65, which is predominantly the retirement age, it depends on your pension rules and your employment rules. There are choices that you are faced with in terms of accommodation. You have the choice to stay where you are. What's wrong with just staying where you are? You don't have to move. You could choose to stay with your children. Unless you are forced to do this through circumstances, I would strongly advise don't do that. Neither you nor your children will be happy. You could buy a yacht and sail around the world. You wanted to know what to do with that 500,000? There's an option. Or you could move to retirement accommodation. Now, I work for an organization that provides retirement accommodation of a range. I don't actually think you should plan specifically to go and live in a retirement accommodation. I don't believe that is the right move. They are for people for whom it is right. It isn't necessarily the first option you go for. Stay involved, stay part of the community, stay active and healthy and what have you, while you can. It's when you become single, where you've been a pair and you feel insecure, where you don't feel comfortable maintaining the house or accommodation you're in, where you feel lonely because you're living on your own. These are the kind of reasons why people move into a sort of social settlement issue for older people. But don't make it something you plan when you're 45. And there are people who start putting their names down for retirement accommodation when they're still light years away from it. It's not on. Before you decide on a retirement accommodation, having decided now this is something you want to do, and despite what I've told you, don't do. Be clear about your reasons, which I've just elicited, and don't do it because the children say so. We have lots of people who come and view some of our accommodation because the children in New Zealand or Denmark or Malta or wherever they're living their high living lifestyle are worrying about mum and dad. So please will you move into a safe place so we can stop worrying. Their problem. Leave them stew in their own problems. Deal with something that's right for you. You're not there to go and make them happy now. You've done that all your life. Now's your turn to be happy. And the reasons why people go there into a retirement accommodation, I have already elicited. And you need to think that clearly through and that this is a right choice for you. When you decide you're going to go to retirement accommodation, what options do you have? You could choose a retirement village where you have little independent cottages or houses, and there are lots of examples. I'm not necessarily pushing my organization. There are lots of them around. And when you look at a village, you have the options of sectional title or life right or rental, and they vary between villages. The services that are offered also vary, and you need to find out if there are things like clubhouse, meals provided, transport, healthcare, and emergency response. When you fall down and fracture your femur, you want to know somebody's going to find you and pick you up, or at least arrange for somebody else to pick you up. Investigate what the levy covers and what will remain your own cost, because that is a distinction. The levy is, by law, not supposed to include anything other than the owner of the property's operating costs. It should cover merely that. It doesn't cover your insurance and the interior maintenance and all those things. You need to keep an eye on what additional costs are going to be. If it's being sold by an estate agent, they want to sell, and they will tell you anything. I had one gentleman phone me one day and said, you're not fulfilling what we were promised. I said, what were you promised? We were promised by the estate agent that you're running a sort of sub-branch of Mediclinic. I said, well, that's news to me. I never promised you that. The healthcare in a retirement village is not an equivalent to Mediclinic. It's not a mini hospital. So please, I'm not going to start stitching up your gardener. Find somebody else to do that. Look at the contract and check that what you are signing for is actually there. Promised you a clubhouse. Is it there? Has it been built? Lots of places have promised you all sorts of things, and then the developer disappears into the far distance. We had one that the developer even went to Australia. We can't get hold of him to come and fulfill his promises. Yeah. Prices vary widely. All depend on the size of the village, the size of the unit, and the geographical position as well as the demand. Lakeside and Constantia vary in cost because just of where they are. And Cape Town is very class conscious. So they're not going to pay Constantia prices in Lakeside. Initial purchase costs can range from 800,000, and that's at the low end of the market, really, in life right and or sectional title, to several million. The top end of the market is not closed. The levies depend on the services, and I've said, and they range from 1,500 Rand a month to something in the order of 8,000 Rand per month per person. So you've got to determine after your tax how much is left to pay for these things. And you also got to ask the question, how much does it go up by annually? Because your pension and the escalation on your pension may not match the escalation of the operating cost of that facility. So you've got to plan for outliving your pension. Those are the issues that form part of your planning. If you don't want to go into a village, you don't want to worry about the gutters and the garden and all the rest of it that goes with a cottage, you can go into an apartment. They're usually also for independent people with the added benefit of some degree of oversight. There's staff on the premises to make sure that you're okay. There are security systems and guards are usually standard. Additional services are an additional cost item, and they can also be sold on sectional title, life right, or on rental contract. And the costs range as for a village, same sort of range. Or you can go to a residential facility. There are slight variations on these. This is the kind of where you have communal facilities like lounges, dining rooms, libraries, exercise classes. Fun stuff. Well, for some it's fine. It's fine. It works. And I can tell you, we are inundated with people wanting those facilities. So there's always somebody who's in the market for that. This provides social interaction, communal facilities and activities. So people do outings together, they play bowls, they play bridge, and they do lots of interesting and active things because their bridge partners live in the same building. Units vary from flats with several rooms to single rooms that are usually just an ensuite bedroom. But some are much bigger than that. And the costs, again, range from 6,000 to 18,000 Rand per month for rental. There goes your tax. Right. Healthcare. This is for when one becomes less able to live independently. Not every residential facility for retired people has a healthcare facility. So again, if you have a condition or you suspect you might develop or you want to be somewhere where it is part of a process, then consider one that has a healthcare facility. As I said, there are not many hospitals, and registration with the Board of Health Providers does not mean that permanent frailty accommodation will be covered by your medical aid. People have a very strange understanding that if you have we have a practice number and it's registered with the Board of Health Providers, that your medical aid will pay your frail costs. They won't. There are some that will pay something like 3 months of the year for your permanent frail care. But the places that are registered, and they like sort of step-down facilities. And where you're there for short-term sort of post-hip replacement, you can go there and your medical aid will probably cover because there is a practice number. But when you become a permanent resident there, your medical aid is going to run for the hills. Healthcare costs a lot. They range from 7,000 Rand a month for a shared room to 25,000 Rand for your own room per month. And that's current figures. If you're only planning to retire in 5 or 6 years' time, escalate it. These prices only cover the basics. They do not cover the cost of the doctor, the medicines, the toiletries, the podiatry, the dentist, the physio, the hairdresser, or your funeral policy. You laugh. Wait till somebody dies and there's no funeral policy. Then you discover how much it costs to bury somebody. And that's also escalating. Costs increase annually. And things like activity programs and outings may or may not be part of the program for permanent residents there. Before making any decisions about this, visit as many places as possible. Shop around. Look around. Ask all the awkward questions. Who owns the place? How long have they been at this? How much do they know about what they're doing? There are lots of fly-by-night developers who have never done it before. They don't know how to even plan how to do the shower properly. Trust me. Watch it. Look at things that are practical and realistic as one gets older. Do not buy a place that is a duplex. The toilet is always on the other floor. Trust me. Check the credentials of the operator, and as I said, check how much of a reputation this developer has. Don't resent growing old. Many are denied that privilege. We're very lucky to be getting older. Thank you.